And finally to Northern Ireland, I'm delighted to welcome another wonderful colleague, Declan Bradley, who's going to talk about the data infrastructure being stood up there. Thanks, Declan.
So I'm Declan Bradley. I'm a public health doctor in Northern Ireland and a clinical lecturer in Queen's University. Could you skip on to the next slide, please? Thank you. So our research team that's part of DaC-VaP, we're all affiliated to Queen's University. Some of us are also affiliated to the Public Health Agency, which is our equivalent of UK HSA, Public Health Scotland and Wales. At the minute, I act as the lead for COVID and respiratory surveillance. The Business Services Organisation hosts the Honest Broker service, which is our gateway into using personal data through safe channels and through an approval process for research, which I'll talk about as we go through this. So could you move on to the next slide, please? Thank you. So Northern Ireland being the smallest jurisdiction has a lot of centralized data sets, which makes in some ways it easier to bring together information for the whole jurisdiction in one place. So in our HSC, which is the Health and Social Care Service, equivalent to the NHS in the other regions, but since it for a very long time had integrated health and social care, which is why it's HSC. It has a central resource, which is the regional data warehouse. So although all of the various healthcare organisations in Northern Ireland have many of their own information systems, all of the big ones are centrally archived in the regional data warehouse. And for the most part, those are available for use in research through the Honest Broker service. So the BSO Honest Broker service is run by statisticians who are from NISRA, which is our equivalent to the Office for National Statistics. They have a governance board, which has representatives of various parts of the service and their representation, and they will take our applications and assess their validity and appropriateness, and if they're accepted as fitting into the 5 Safes framework, which is about safe projects, people, data, various safe ways of protecting privacy, then we get approval and they will provide data for us. The way that we access the data goes through a lot of safety checks. So they will remove all of the identifiable information. They only give us fields that could not identify anybody, and they replace all of the identifiers with a anonymous study ID. And whenever they've finished joining together all the data sets, they remove the ability to link back to the original person. So by that time, the data are anonymous. We access the data through a Swansea hosted service called SERP, the Secure Research Platform. So as he said, the SEAL data bank in Wales is a good resource. So my understanding is this is piggybacking on the development work that was done in Wales. So it's a service that they provide for us. You can also, as a researcher, go into a safe setting where you're in a supervised room when you work with the data set, where you can't bring your phone in or take any notes, and it's a means of protecting people's privacy. And whenever we have some results that we want to take out of the service, then the statisticians will check all of our tables and charts to make sure that we're not bringing out any small numbers that risk disclosure about any individuals who are in the data set. Could you move on to the next slide for me, please? Thank you. So if you're interested in what data sets are available, they are all detailed on the HDR Health Data Gateway, and you'll find information about those data sets, what fields are contained within them, and their completeness and their quality. So that's a little snapshot of those. The team is also working towards a federated cohort discovery or tool towards being part of the Co-Connect project as well, which will allow more discovery, more value to be extracted from those data. Could you move to the next slide, please? Thank you. That is just a little bit of information about the CERT platform. If you could move on to the next slide, please. It's got the main detail. Thank you. So the the backbone of almost all of our projects is who's in Northern Ireland at the moment, which we base on the GP registrations from the NHIS system, which is why it's at the top of this. The little cylinders they represent data sets or databases. They're little stacks of computer disks. So the NHIS system is the backbone, and then we join in all of our other data sets to that cohort that's based on that. Unlike the rest of the UK, we don't have access to primary care data at the moment. There's a big project about the use of primary care data in Northern Ireland, but at the minute it's not joined up to this and we're not currently able to use it. So we have to find other ways of constructing this equivalent data to the rest of the UK. And one of the main sources for that is the vaccine management system. So we don't have to get information from the GP to find out who's vaccinated. There is already a big central database that manages the entire Northern Ireland COVID vaccine program. That also includes influenza vaccines for last year as well. We've got all of the COVID tests in one place as well. That was a legacy of the contact tracing system. So we get that in there as well. COG UK sequencing, hospital records, deaths, prescribing and maternity system, all there and ready to use. Unlike the rest of the UK, or at least some of the other parts, we don't get that live. Whenever we want to contribute to one of the projects, we need to have a developmental period where all of the data sets are brought up to date and linked again for us. So could you move on to the next slide, please? Thank you. So I covered quite a lot of that already. So we can probably, in fact, see Aziz has popped up on the screen, so I'm suspecting I'm coming to the end of my time. So I wanted to say that a lot of the work that we've done in the last year on this project with this team wasn't really practical or possible before, and working with this team has increased our ability to deliver this kind of work. The investment from HDR UK has supported what's called the NITRE project, the Northern Ireland Trusted Research Environment project, and that's really increased our capability as well. So we've gone from being really very early in our journey in this to now beginning to catch up with the other regions in our maturity. Thank you.
Brilliant. Thanks so much, Declan. Fantastic.